Hi, I'm back to discuss Fragile X. It is an add on to the autism lecture. Fragile X is the one known genetic cause of autism um, that accounts for about 5% of cases. Other cases of autism that are linked to purely genetic disorders like tuberous sclerosis, neurofibromatosis represent much smaller numbers, and a lot of the people that have those disorders may not express traits of autism spectrum disorder, but in Fragile X, more often than not, they do. And I want to point out this little boy, this picture. When we talk about features of autism, I want you to note these larger ears. They appear to be a little bit low set to me. Long forehead, long face. Um, and those are things that are very commonly seen in Fragile X. They're sort of a tip off. So, Fragile X is the most commonly identified cause of autism spectrum disorder. It is one of the few things that if somebody has a family history, you can screen for and give them some actual advice about, whether they are likely to have another child with a disorder, what they can do to minimize the odds of that happening. It's one of the few things that we have definitive answers for. Fragile X can occur in both genders. It's more common in males. When females do get the disorder, are usually mildly affected because of X inactivation. Remember that males get one copy of an X chromosome. So they're more likely, if mom has that mutation, they're more likely to get the X chromosome with it and not have another X chromosome to sort of cancel things out. So X inactivation, if you inherit the affected X chromosome from your mom, and you also inherit a normal X chromosome from your dad, remember that in fetal life or early in embryonic development, one of those X chromosomes in each cell line is going to be inactivated and silenced. And it's random. And it's about 50-50. So when females do inherit this disorder, very often what you'll see is a much milder expression. Instead of severe intellectual disability and autism, they're getting learning disabilities and social anxiety. Because in any given cell, there's only a 50-50 chance that that trait is expressing itself. So the consequences of it are less severe. Prevalence, males between 1 in 4,000 and 1 in 7,000, females 1 in 6,000 to 1 in 11,000. Those statistics are gotten from the National Foundation for Fragile X. Genetics and inheritance. So this is what happens. So it's not like a trisomy. What you have, the reason it's called Fragile X is that this X chromosome has places where it's prone to these duplications, these repeats of a sequence. Remember cytosine, guanine, thymine, adenine, those bases? Well, in Fragile X, what they see are like these sort of like genetic stutters of CGG, extra CGG bases. And that gene expands and becomes bigger. Once it starts that process, once that mutation occurs, the chance is that it's going to keep making those mistakes in future generations and make more of them. You could get really nerdy with the science. I could talk to you about AGG repeats that intersperse with those repeats and cause a protective effect so the gene doesn't keep making mistakes. But we'll keep it simple. There are extra CGG bases, and these bases have an effect on the protein that the gene makes. So the gene in question is called the FMR1 gene. If you have 50 to 200 repeats of this CGG sequence that don't make sense, you are a premutation carrier. It's an unstable mutation. It could get bigger. Average person has 45 or fewer of these repeats. A carrier has 50 to 200. In that gray area, 45 to 50, we have people who aren't quite carriers, but if you identified this, you would want to watch them to see and counsel maybe future generations. Greater than 200 repeats results in full Fragile X syndrome. And the way that this works is that the FMR1 gene makes a protein like most genes do. It has a single job. It makes this FMRP protein. It's abundant in nerve cells and also in testicular cells. But one of the functions is thought to be It's very abundant in neurons, especially in those dendrites, those long branchy parts of the neuron that communicates with other neurons across the synapses. So you get abnormal signaling in Fragile X because in Fragile X, this gene gets methylated in one region, and the production of this protein, this FRMP protein that helps neurons communicate across the synapses of the brain, is deficient or absent. And depending on the number of repeats you have, that's going to determine how much methylation there is. It's going to determine how much protein is produced. So if you don't have this protein, you get very abnormal signaling in the brain. And that's how Fragile X works. Now, features of Fragile X, we saw that picture and I showed you that cute little boy. Large ears, very characteristic of this syndrome. A long face, particularly in the forehead. Smaller, pointier chin, soft skin. People are double jointed, particularly in the finger joints, flat feet, a high arched palate, larger testicles because that protein again concentrates, so you get like a swelling in the testicles called macroorchidism. And then we have more of our behavioral and health consequences. So those were sort of features that you can use to identify the syndrome. But consequences of this disorder: cognitive impairment, ranging from mild learning disabilities, those are people with fewer repeats, or girls who can still produce a fairly good number of, or a fairly good amount of that protein, all the way to severe intellectual disability in kids who produce almost none. So most males fall in the moderately impaired range with an IQ of about 50. Most girls end up with some learning disabilities and some mental health things. Speech and motor delays are common with full Fragile X. These kids may have more frequent ear infections for unknown reasons, and emotional and mental health issues. Now, in milder cases, what you might see is a tendency towards social anxiety or general anxiety disorder. In more severe cases, you might actually see behavioral aggression and other really severely inappropriate behaviors. And that's all from the lack of that protein in the brain or in the neurons and other nervous tissue in the brain. So premutation carriers. With Fragile X, they really don't talk about recessive versus dominant. What they talk about is, severity of and variability of expression. But if you're a premutation carrier, you usually escape all of those things: the long face, the large ears, the cognitive delays, the social impairments. However, there are a couple of things that are associated with being a carrier that are health risks. So one of those is Fragile X associated primary ovarian insufficiency. And in women who are carriers for Fragile X, very often what you see is a history of irregular periods, infertility, and sometimes early menopause. And a pretty good number of these women will go into menopause before the age of 29. Average age in America is 51. About 20% of women who are carriers of Fragile X will experience primary ovarian insufficiency. In the general population, this risk is 1%. So it's a 20-fold risk for women who have this mutation to experience problems with their female reproductive cycle. Also associated with Fragile X is Fragile X associated tremor and ataxia syndrome. It affects motor and balance. The carrier prevalence in America for Fragile X is females, 1 out of 151 women, and males, 1 out of 468. So you can see it's a pretty big number of people relative to the number of people with full Fragile X. No treatment exists for the cure of Fragile X, but there is therapy, like for all autism spectrum disorders, to increase social skills, communication skills, sensory processing issues, and cognitive delay. We have early intervention, as always, individualized educational planning. Genetic counseling absolutely should be offered. So anybody with a family history of autism should be offered genetic counseling. Anybody with infertility, particularly those females who are having ovarian insufficiency, should be offered genetic testing for Fragile X. And from there, carrier status can be confirmed Risk can be discussed. We can offer pre-implantation genetic diagnosis for a family who would like to have another child, or even if it's a first child, but they have this family history. And people can be referred to National Fragile X Foundation. And that's it for Fragile X. We will talk about newborn screening next. See you then.